Before approaching my patient, I'm gonna do my hand hygiene. Palm to palm, back of the hand, fingers interlace, fingers interlock, thumb in rotation motion, fingertips, and let it air dry for 20-30 seconds. Now, I'm gonna check for scene safety. I can see no trips or falls. I will now freely approach my patient. Now I'm gonna close the curtain and close the door for privacy and dignity of my patient. Hi, my name is Donna. I'll be your nurse today. How are you?
I'm good.
May I know your full name and your date of birth, please?
Yeah, it's Michael Lloyd and his date of birth is the 10th of January 2006.
Okay, and may I know who's with you today, Michael?
Yes, I'm Steph, I'm his mum.
Hi, nice to meet you. Michael, I can see that you have a red ID band. May I know what your allergy is?
He's allergic to penicillin.
Penicillin. And what happens if you take these medications?
He has anaphylaxis.
Oh, okay, that's good. Okay, I confirm that it's also in here in my medication chart. And first, Michael, I'm here today to give you your oxygen that will help you breathe easily. But first, let me check your prescription chart with me. I have here Michael Lloyd, date of birth of 10th of January 2006, with a hospital number of 0004321. You're in Ward A&E. You are admitted today, 29th of November 2023 at 8 in the morning. So your height is 5 feet 5 inches, weight is 60 kilograms, body surface area is not yet computed. Your consultant is Dr. Wright. So let me just check if all the graphs in each pages are in your correct name. Examiner can confirm that graphs are all correct. So moving on to the first page. So your prescriber is Dr. P. Wright with the NMC number of 3214213 and the blip number of 642, signed also by Dr. P. Wright. And I have here the nurse that gave your medication earlier, Laura Bell, at the surgical assessment unit, signed also here. And I have here your allergies to penicillin, which causes anaphylaxis, signed by Dr. P. Wright with a blip number of 642 today, 29th of November 2023, and you don't have a medication risk factor. You also don't have a single, only once medication. Turning on to the next page, you have a prescribed oxygen. You are not a CO2 retainer, so your target oxygen saturation is 94 to 98%. Examiner, may I know what's the latest oxygen saturation of my patient?
92%.
92%, so I'm gonna give you 15 liters per minute via reservoir mask today, 29th of November 2023 at 10 in the morning. That is for 7 days. Signed by Dr. P. Wright, pharmacy tracked by C.G. Thomas. Examiner can confirm that the prescription is signed, valid, and legible. Turning on to the next page, you don't have any antimicrobial medications and also regular medications and infusions. So, Michael, this oxygen therapy will sometimes causes side effects such as headaches, nosebleeds, and dry mouth. So you don't have to worry about that. We will continue to monitor you all throughout this treatment. And if you need a regular oral mouth care, we can also help you do that as well.
Okay, thank you.
Thank you. So I'm just gonna go out and grab your oxygen mask, and I'll come right back.
Okay, thank you.
So I'm gonna do my hand hygiene. Put on my PPE. Put on my gloves. And I'm now ready to get my consent. So I have here my reservoir mask that is appropriate for my patient's size and also appropriate for the prescription that was written in my chart. So I can confirm that the package is clean and dry, no tears or hole. Expiration date is 2027, so I'll be happy to use this. Now I'm ready to approach my patient. Hi, I'm back. I know your full name and your date of birth again.
Yeah, it's Michael Lloyd and his birthday is the 10th of January 2006.
Okay, that's good. I have here your mask, Michael. Can you sit right up for me?
Yeah, I'll have them sit up.
Okay, thank you. Gonna hook this, the oxygen flow meter, turning it up to 15 liters per minute as ordered. First, I'm gonna check if my oxygen mask is working by putting the one-way valve here until the bag is fully inflated with air. I can confirm examiner that my mask is working. So Micah, I'm gonna put this over your nose and mouth and over your head, adjusting the strap, making sure that it's not too loose or too tight. Also adjusting the nose brace. There you go. Michael, are you comfortable?
Yeah, he's comfortable, thank you.
Okay, that's good. So I already administered the oxygen. So all throughout the whole treatment, we're gonna check the skin around your face and also at the back of your ears and also the back of your head, just to make sure that it's not irritated with the mask and straps. And we're also going to provide you with regular oral mouth care just to make sure that he doesn't have any mouth dry. And also going to monitor your oxygen saturation all throughout the treatment. So just to make sure that we're reaching the target of 94 to 98%. And if we do not reach those targets, we're going to escalate right away to the doctor.
Okay, thank you.
That's good. Do you have any questions for me?
No, I don't think so.
Okay, that's good. If you need anything, here's the call bell. I'm just gonna go outside and document. Thank you.
Thank you.
So I'm gonna expose my apron. And my gloves. Gonna do my hand hygiene. And I'm going to do my documentation.